So the healthcare world has changed. We have a lot of really unprecedented downward pressure on reimbursements, a lot of downward pressure on our top line revenues. Think about items like as Medicare sequestration, value-based purchasing, the continued effects of the recession, no Medicaid expansion in a lot of southern states, which the end result of that is that healthcare providers now have to cut expenses just to get to the same margins that they've had in the past. So a lot of our clients say, well, how do we do that? When you look at your expenses beyond staffing, usually the second or third item right behind that is purchase services, your vendors. So how do we really take a look at that and cut costs at that level? Well, the first thing you do is you take do a benchmark study. So you look at your expense line items as a comparison to your revenues, compare that to your local and your national peer group, and then also to yourself back in your more profitable years. Once you've done that, really pull your contracts, read and understand each of your contracts with your vendors. Look for items, services that are potentially duplicated. Look for vendor contracts that might be approved on an annual basis by the wrong department. Look for automatic renewal contracts, evergreen clauses, so the contracts just roll every year. And then look for automatic inflationary price increases. As a vendor, it's hard to say this, but the days of automatic price increases in vendor contracts are really gone in healthcare. The world has changed here, so to speak, and healthcare providers are suffering a little bit, and it's appropriate and it's reasonable for the vendors that provide these services to share in that pain. And the last thing you should do is contact CRI. We have a healthcare team that's very experienced that deals with healthcare providers of all shapes and sizes throughout the South. We'd be glad to help you.